Welcome to another edition of Live from QCP, our weekly interview series with supervisors and staff who talk about career opportunities at the agency.
QCP Article 16 Clinic provides clinical evaluations for individuals with diagnosed developmental disabilities or children or adults who need determination if they have a developmental disability. So these evaluations are used for primarily OPWDD eligibility, for Social Security SSI application, for Medicaid application, and primarily a lot of services in the city of New York or the state of New York where developmental disability is being verified. The QCP Article 16 Clinic is a support to many departments in the QCP system. We provide the clinical background for many participants that join our programs, from the day programs to the residential programs, and to whatever situation the agency is presented with when it comes to being presented with problems of any individual who may come before us. The QCP Article 16 primarily employs men and women with degrees in social work, psychology. We do have a physician on board who has been with us for many, many years, so we are not recruiting for that, but we are always looking for clinicians. Now, the qualification would be someone with a master's degree and preferably with a New York State license. The reason I say that is all our services are paid for by insurance reimbursement. So with that said, the staff that I do have right now all have master's degree, some with New York State licenses, and many, many years of professional experience in working with men and women, children and adults with developmental disabilities, and some are coming from mental health backgrounds. The men and women who continue to work for QCP are one of the best, I think, in the industry. Their experience ranges from working in developmental disabilities programs. Some have come from residential programs certified by New York State Office of Persons with Disabilities. We also have men and women who have joined us from the mental health field. So the strength of their experience really comes from many years of working both in the DD field and the mental health field. And we continue to push that requirement because in the work we deliver, these backgrounds are very essential in producing the kind of clinical work that we provide the agency and for those other agencies that come to us for our evaluations. The one thing I can say is that the combined years of experience of my staff is a testament to the kind of work environment we have here at QCP. My longest term employee has been with the agency for over 30 years. My newest, who I hired about 3 years ago, she's been here 3 years, and I mean, my turnover rate is very minimal. So having said that, the fact that they remain at QCP and in this particular practice is a testament that there is professional satisfaction in the work we do, and that the agency also gives them sufficient recognition both in benefits and salary that make the decision of remaining a very strong motivator for continuing their affiliation with us. One of my work is to be a liaison from the agency, QCP, to the public, to the community of Queens and New York City. And we do get a lot of questions and inquiries from parents regarding our services and supports that they need for their children with developmental disabilities. And I think my department's contribution is to provide the information and referral service. Although it is not a mandated service of a clinic, and we certainly do not get any kind of reimbursement, insurance reimbursement for this service, I think with the years of experience that I have and the rest of my team, we are able to direct families to services, programs, hospitals, and clinics that will address their presenting problem. In addition to the evaluation we provide, we also provide supportive counseling. So we need to verify the insurance, of course, to see if the service will be reimbursed by their insurance coverage. But that's one service that we can help with our parents, because taking care of a child or an adult with a disability is a lifelong commitment for a parent, and it's not an easy situation for them. So for them to come to us and we can deliver that service to them, I think is a very big contribution of the QCP clinic to the community of Queens. I can say with confidence and conviction that the people I work with at QCP is one of the best and remarkable group of professionals, and each day is a state of gratefulness, I suppose, especially at a time like this, where we're all being challenged by work schedules, health condition, and I do have to say that my team, my clinical team, the rest of the QCP departments have really rolled up their sleeve to meet this challenge, and it is a wonderful experience to be working with vibrant and dedicated employees here at QCP, from the very top to our support and maintenance people who make it possible for us to enter our facilities with no concern of being limited.
Thank you for joining us this morning for Live from QCP. Please come back and join us next Friday at 10 a.m. for another edition of Live from QCP. Have a great weekend, everybody.